As you all are aware, we're dealing with extraordinary times. And our first responders are the heroes who are out there every minute, saving lives and helping to stem the tide of this disease. And I thought it would be great to talk to the king of the first responders from the great LAFD here in Los Angeles, Fire Chief Ralph Terrazas, taking time out of his unbelievably busy schedule to just talk about, what's actually going on, what the future looks like, what we can do to protect ourselves, maybe what we can do better and what to worry about and what not to worry about, frankly. Chief, thanks for being here and taking time. This is awesome of you.
Well, Rob, thank you for the opportunity to talk to you this morning. I really like your cap.
Thank you.
LA City Fire Department, we're very proud of our department. And we're doing things we've never done before during this pandemic. The day one, we started assisting the mayor's people to test the public. And we're used to fires and brush fires, high-rise fires, earthquakes, but a pandemic is something we've never been involved with before. But I thought to myself, we take an oath to protect lives and property, and definitely public testing of this deadly virus is in that category.
What do you think the single most important thing people can do? How many weeks into this are we now? We're 8 weeks into it?
So the direction that I've been telling the public is you got to listen to the social distancing guidelines. You should stay at home. You're safer at home. You should wash your hands frequently. If you have to get out in public, wear a face covering and maintain that 6-foot separation if you're in areas like at the market where you're going to encounter more people at the market. The markets have done a good job. They've been marking the ground with tape to maintain that 6-foot separation when people check out.
Obviously, this is not just for Los Angeles. This is for everybody across the country who will be watching this. But what do you recommend people do if they think they have a symptom, think they may have this?
Number one, monitor your health. Stay as healthy as you can. Now, if you start developing symptoms, coughing, fever, things of that nature, they're flu-like symptoms, call your healthcare provider and get some guidance. If there's any doubt whatsoever, call 911 and we'll be there in 5 minutes. But we really want to minimize unnecessary transports to the hospital because it does expose the patient to the potential for contracting the virus.
So I have just a crazy question, and it doesn't even really make that much of a difference because you should do it regardless. But when one is wearing the mask and they're out and about, is that for them to not transmit it or to them not get it or both?
I'm not an expert, but I've been listening to the experts almost every day. And they tell me it's more so for the person who may have the virus. There's a big concern that many people out there in public are asymptomatic, but they can spread the virus. So if you wear the mask, you're actually protecting other people. If everybody has the mask on, you're better protected.
Now, everybody's familiar with that sort of papery mask with the metal clip that goes around your nose, right? That's the most rudimentary one out there, and that's still fine to use, right? Anything is better than nothing.
Could be anything. Could be bandana, could be anything. Our protocol is when we get on scene of an incident, we give the patient a surgical mask. It's like the one you described. That immediately reduces the risk of exposure to a low-level exposure.
People sometimes think of firefighters as firefighters, and maybe they show up to an accident. But what you said earlier is I find so profound. As someone who plays a firefighter on television, is you swore an oath.
Right.
I mean, you swore an oath to protect lives and property in whatever that may bring, and a pandemic being something unprecedented. What have you encountered or learned that you will influence any practices going forward?
One thing that we've implemented in the last 2 weeks, we've been working on it for over a year, is telemedicine. We're finding that we can maintain and manage call load by eliminating these low-level emergency calls that are really not emergencies. 911 is supposed to be for life-threatening emergencies. So telemedicine allows us to have a doctor or a nurse practitioner or a physician assistant on our dispatch floor. So when the call comes in, and if it's a low-level call, the caller can get transferred to the doctor. And the doctor can make an assessment. And they use something like FaceTime so they get a visual with the patient. Right. And we're finding that many times they don't need a transport, especially now. When you think about it, it's a better level of patient care. It's reducing the risk of an emergency response. It's reducing the potential for exposure to our firefighters and to hospital staff. And lastly, it's helping reduce hospital emergency room overcrowding. So we're very proud of that program. It's evolving every day, and I see that lasting far, far into the future.
So obviously this is a time that nobody wants to go on any longer than it has been. And, just on my end, I've been so fortunate to be able to be in a beautiful place. But I think of people who aren't so fortunate. I think of people who are in small apartments, in places where there's horrible weather, people who may be alone. And my heart just goes out to them. I'm wondering if you're seeing a side of humanity that you wouldn't normally see, and what kind of stories are coming out of the front lines of this.
I am seeing those positive stories. I found in my career over 36 years now, in times of crisis, communities come together. I saw that during the Northridge earthquake. I've seen that during brush fires. And I hear anecdotal stories throughout the department where our people are delivering food or providing shelter of some sort.
That's the other thing about what you guys do as firefighters. The fraternity that is in the firefighting world has always been so inspirational to me. And, I've lived through the wildfires as up here, and to look at the highway and see, brigades coming from all over the country, not just California, all over the country. It's like, when your brothers and sisters need help, you guys are there.
Yeah, I share your sentiment, Rob. We have one team color on the LAFD. It's LAFD red. I don't really care what your background is. If you're man or woman or what ethnicity, when the bell goes off, we go. And we're going to get there as fast as we can. And if we have to go outside the city to Malibu or wherever, sometimes up and down the state, we go with serious intention, and we're going to be there fast. Sometimes we're sending helicopters, 50 firefighters, 50 fire trucks. We go where we're needed, and we take great satisfaction in making a positive difference.
And I would say to people watching, if you're as inspired by that as I am, you just heard they go where they're needed. Well, we should go where we're needed, and where we're needed is right where we are. Let's not go anywhere right now. And it's the least we can do when other folks are legitimately putting their lives on the line out of the real world.
Yeah, I agree. I see all these demonstrations across the country that they want the restrictions to end. I don't think they're thinking about the long game. This is a marathon. It's not a sprint. If we pull back as a government at the state level, federal level, or local level, we could have this virus continue to spread even worse the first time around. The second wave is a big concern. So to continue to social distance, to continue to shelter at home, to continue to wash your hands, it's going to pay off. I know it's painful right now, but think about the long-term gain. What's better for society in general?
Is there any place people can go if they have any other questions about anything about COVID-19?
Absolutely. Go to the website, cdc.gov, Center for Disease Control. It has all the information you need about the coronavirus and what you can do to protect yourself.
Well, thank you. This has been great. I know how busy you are, and to take the time to reach out to everybody, across the country. They get to know you now, know how lucky we are to have you in the position we have you in. And this has been great. And when this is over, you and me on the golf course, put it on the calendar.
Absolutely, Rob. Once again, thank you for the opportunity. Good luck on your show. You're representing firefighters well, and I look forward to learning from you on the golf course.
Thank you. Appreciate it. Elbow bump.
All right. Bye-bye. We'll see you.